I am Dr. Jay Hitson with Blue Umbrella Medical Center. Stem cell therapy has brought up a lot of questions, and I'd like to go through some of those FAQs with you today. First, let's just kind of talk about what stem cell therapy is. Essentially, stem cells can be harvested either from the patient specifically, or they can be donated. That donation procedure we'll get into in a little bit, but basically they can be donated, and then stem cells, true stem cells, can be injected to any damaged tissue in the body, and it will start to reconstruct and start the healing process in those damaged tissues. Now, it's getting used most often for like knees and shoulders and hips. So when people are being told that they have bone-on-bone knees, so for instance, let me see if I can get these two examples. So right here we have examples. This is what a healthy knee looks like. So you can see good, healthy tissues. Everything's intact, nice cartilage in the middle. But then a knee that's really been worn down. This is a knee that would be, again, often considered bone on bone, where the tissues have been just completely worn down. There's not much cushioning in the middle. What we're doing with stem cells is we are taking those and stem cells and injecting those into the joint space, and it starts to work on the connective tissues and reconstructing the various damaged areas of that knee, or like for instance a shoulder. A good healthy shoulder has good articulations, nice smooth cartilage. This is what a damaged shoulder looks like. Again, it's not smooth at all. It's grinding. This particular shoulder right here, this would not have very good range of motion. This person wouldn't be able to get their arm behind them or reach up into those top shelves. So with these various stem cell therapies, what we're able to do is we're able to inject into those into the joint space, and it starts to go to town to reconstruct what has been damaged. Now, it can be used on really anything that's been damaged, but most specifically, these bone-on-bone knees, these really angry shoulders, hips. We do a lot of paraspinals, and actually we're going to be able to do this with neuropathy here very, very soon. Question we get a lot is, does it work? And the answer is yes. It absolutely works. It's just the better question, though, is will I get the results that I'm expecting? One of the things that we like for people to understand is that there are going to be limitations to matter. So, somebody who comes in with a shoulder who looks like this, we can't make you look like you're 20 years old again and get all of that back. But it's amazing how much function we're able to get the average patient back. And one of the things is, with regards to it always works, is sometimes we just can't get enough of it in. It takes a few injections to build back. It takes a few rounds to build back a shoulder that is this damaged. So it just depends on the amount of damage and how many rounds we're able to get in to whether or not we can get the kind of results that each individual patient is really looking for. Obviously, the less damage, the easier it is to fix, as always. The other question we get is, does insurance cover this? And the answer is yes. Many insurance companies are starting to cover this particular work. Now, there's a lot of them that still don't, but specifically a lot of the Medicare, specifically Medicare Part B, is covering a lot of this particular work, especially with one specific product that we're using. But then one of the really wonderful things about these particular therapies is that the prices are starting to really come down as technology has evolved. So even if your insurance company does not cover there are some really, really affordable options. What used to cost thousands and thousands and thousands of dollars for this is now costing only a few $100s. So even if you don't have great insurance coverage, you have high deductible, there's some real viable options out there that are getting some incredible results. I will say I've had it done. It's been amazing. It had one injection in my back. Incredible. What it's been able to do for me personally. Had a lot of people. I've had my son is a baseball pitcher. We were able to inject his shoulder. Made a huge difference, and his shoulder's great now with just one round. Again, we work with so many different patients who've just really gotten outstanding results with this. So yes, it absolutely does work. There's several other factors that will dictate whether or not you get the kind of results that you're looking for. Let me also just say this. We in specific do not like doing this particular therapy without at least a physical therapy evaluation, just to make sure that you're not going to wear that joint back down again. Like for instance, if you're walking on that knee imbalanced, well, the injections will work, but what happens is if you're still walking imbalanced, you're going to grind that knee back down prematurely. Then you're going to be less satisfied. So we always like to do an evaluation, make sure that you're a great candidate. A very common question from a lot of the media coverage is, where do these stem cells come from? Specifically, they're concerned about aborted fetal tissues. That is not where first of all, if you get true stem cell therapy, the stem cells are coming from you. So that's also in the same vein, PRP, Platelet Rich Plasma, which is also a stem cell recruitment type therapy, that also is coming from you. So there's no risk of any kind of adverse reaction, anything like that. Now, if you want the products that the insurance companies are covering, that is donated tissues, but those are from live, healthy births. So just like you can go donate blood, and then they will use that blood to help somebody else. Well, with these mothers from live healthy births can actually donate the placenta and the umbilical cords, and they can actually harvest the cells from those tissues, which is really awesome and very, very cool. So yes, that it is absolutely, moral harvesting. The best way I can describe it. The last question I usually get is, how long does this last? The answer to that is it varies, but it varies depending upon the patient. So to give you an understanding of what I mean by that is, the results can last an extremely long time if the patient isn't grinding what we did back down. So for instance, if you have somebody who comes in and we work on their knee, but they still are imbalanced and they're still walking on it wrong, or they still won't give up certain activities that are really damaging to that knee, well, yeah, that knee is going to have issues sooner than somebody who is doing their stretches, they're doing their exercises, and they did all of the other things that they needed to do to get it all balanced out. See, that's the biggest factor. It can last years and years. I mean, we've had people who are coming back after a decade, who are just now starting to feel the effects again. Keep in mind that you have continued to age, so the aging process hasn't stopped. So even though we're putting this in, this is not artificial. This is not a man-made product that has a shelf life. This is your cartilage, your tissue. So it's up to you if you're going to grind that back down again. But the natural aging process and how we we do deteriorate certain things over time. Yeah, like you said, in general, a lot of people get 3 to 5 years, but again, we've had people who've gotten over a decade, with just a few injections. So it just really depends on how you're going to treat it. So I hope that explains a lot with regards to stem cell therapies. We refer to it here as regenerative medicine. That's just the terminology that is applicable with the type of products that we use. You also hear us refer to it as stem cell recruitment, more so with the PRPs and those kind of things. Those are not true, not true stem cell transplants, anything like that. And furthermore, we just have really liked the PRP versus the stem cell, just because it's so much more affordable. It lasts just as long, a lot less downtime, a lot less risk, just a whole lot of wins with regards to PRP. So that's just one of the reasons we've been using it a whole lot more. But I hope that answers a lot of your questions with regards to this whole area of stem cell therapy. It's actually been around for quite a while. We've been doing it for over 4 years just here, seeing great results, kept so many people from surgery, which anybody who's had joint replacement surgery, how long that recovery is. And how much time, how much downtime there is. And also there's just risks, there's risks with any surgery. So it's a really fantastic option for a lot of people who are looking for a better alternative or are early on and they just want to protect their joints. I am Dr. J. Hitson with Blue Umbrella Medical Center.